Welcome to the BBC News at 1. The day before the new Nightingale Hospital in East London is set to open, with a capacity for 4,000 coronavirus patients, medics are continuing to say that they're not being given adequate masks, gowns or gloves for personal protection. And with as many as 1 in 4 doctors currently off work, there's also frustration that NHS staff aren't being tested in sufficient numbers to find out if they have the virus. The official figures for deaths in the UK have now been extended, as well as the daily toll of fatalities in hospital. There are now also weekly figures, which include people who've died at home or in residential care. Spain has recorded its worst daily figure for fatalities. 849 people have died there in the last 24 hours. With our first report this lunchtime, here's our science correspondent, Palab Ghosh.
From conference centre to what's to be a 4,000-bed facility, London's Nightingale Hospital in East London, ready with intensive care beds and ventilators to deal with the expected surge in cases over the coming weeks. Doctors and nurses from across the country applauded as they volunteer to work in the capital, but there are fears that they don't have the tools they need for the task ahead.
It's an incredible feat, and in fact I've just volunteered to work there myself as an intensive care doctor, but I'll be really honest with you, things are really tough on the front line right now. My colleagues in London are, I'll be honest, they're completely broken. We're seeing a lot of patients get sick, very, very quickly.
The government has been stepping up its efforts to get personal protective equipment, masks, gloves and aprons to frontline health and social care staff, following reports of shortages, but many doctors are reporting that they're still not getting through.
I don't have any visors, I don't have a face shield or goggles. I should have a full sleeved gown if I'm following the guidance by the World Health Organization. And I think it's frightening that I'm putting myself at risk and potentially therefore risking myself becoming ill and not being able to help others.
NHS staff are now being tested for coronavirus at this temporary drive-through station in the car park of Chessington World of Adventures in Surrey. Until this week, very few frontline staff were being tested. This has meant that they had to self-isolate if they or a member of their family are suspected of having the virus. The Royal College of Physicians estimates that 1 in 4 staff are unable to treat patients because of this.
I'm really desperate to get back in the workplace. I do wish that we could have testing done so I could know definitely if I had coronavirus or not. Because my symptoms, I had a fever, but I didn't have any throat symptoms, so I'm not 100% sure whether I had it or not. So it'd be useful to know whether I had it, so to see if I can have immunity in the future.
At Downing Street, the government's chief scientist showed new figures on hospital admissions that suggested that some of the social distancing measures might just be working. Although there's a steady daily increase, it's thought that it's not accelerating at a rate that would completely overwhelm the NHS. Nightingale field hospitals are being put together at conference centres in Manchester and also in Birmingham, and more protective equipment and tests are promised.
We are all aware of the stresses and strains here and doing absolutely everything, and people supplying this network doing absolutely everything to try to ensure that the gaps are filled ASAP.
As London's Nightingale Hospital gets set, the hope is that the social distancing measures will have bought enough time to ensure that frontline staff have all they need to save lives. Palab Ghosh, BBC News.
Let's pick up on some of those issues with our health editor, Hugh Pym. Hugh, first of all, these new weekly figures of fatalities outside hospital, can you explain about that?
Well, Rita, people have been getting used to the daily announcement by the Department of Health at Westminster covering the whole UK for the number of deaths. Those are deaths in hospitals. What we've got today is the Office for National Statistics for England and Wales covering the total number of deaths, including those in the community, for example, in a care home or somebody in their own home. And that showed for a week, the latest week they've got up until March the 20th, 210 deaths linked to COVID-19, as opposed to the 170 which had been reported at the time, added up by the Department of Health. So it looks as if there were rather more deaths than we thought. But those extra ones covered by the Office for National Statistics are based on GPs and doctors on death certificates saying they think the death is linked to COVID-19. All the ones in hospitals are based on people who were tested. So there's a little bit of ambiguity around precisely what this means, other than confirming, of course, very sadly, some people lose their lives because of something linked to COVID-19 or COVID-19 away from hospitals.
And Hugh, NHS staff continue to be very concerned about these two issues, testing for coronavirus and the lack of protective equipment.
Yes, we heard there about the lack of protective equipment, even with a really big push by the government and by NHS England to get all this equipment out to hospitals and GP surgeries and other care environments, millions of masks, millions of other items. There are still people on the front line telling us that they've not got the right gowns, the right visors and the right other equipment. And they're very, very frustrated with the case numbers building up. On testing, NHS workers are really very anxious to get tested if they've had to self-isolate at home with some symptoms which might not be COVID-19. If they could be tested, they could be free to return to work if that's negative. Now that's beginning to happen. It was announced by the government at the end of last week. It's already happening in Wales. It's beginning to happen, but not a lot of evidence on the ground how many people in the NHS so far have actually been tested and free to return to work if that's appropriate.
Okay, Hugh, many thanks. Hugh Pym there, our health editor. Now, the Scottish Government have just announced emergency measures for Scotland. The First Minister,